Welcome back. Time for another Sunrise interview. Anthony Vasquez, Lauren Holcomb, happy to be joined by local pediatrician Dr. Namisha Amin. Doctor, it is back to school season and we're talking back to school vaccines. Doctor, just emphasize the importance of vaccines now that school is starting to kick back up.
Absolutely. Well, I think we all know that our precious kids are very good at spreading germs.
Yes.
And so it is important for them to get their back to school vaccinations right now if they haven't already, namely so they can enjoy their first day of school and so all of our kids can be back in that school environment in a safe and protected fashion away from certain infectious diseases.
Yeah, and what are some of these diseases that we're looking out for?
The standard vaccination schedule for children protects against a handful of different infectious diseases. And that ranges from things that we used to not see very much, like measles or polio, to different diseases that actually still exist within our community, such as whooping cough, meningitis, pneumonia, vomiting and diarrhea, and hepatitis A, as well as hepatitis B.
And for parents still looking to schedule vaccine appointments for their kids, how can they go about doing that?
Absolutely. So they can call their pediatrician's office, which are always stocked with the back to school vaccinations, but there are also different mobile health clinics here in town that can help with that. If their pediatric office happens to be very busy, which we tend to be right now, and they're struggling to find an appointment, there's always a way in which we can get the kids their vaccinations so that hopefully they will be ready to go by middle of next week.
That's awesome. And then in relation to these public health cuts that we've seen in the past few weeks, have there been more or less parents maybe rushing to go get those vaccines for their kids?
I would say it feels like a steady trickle, like it always does, but there have definitely been a lot more discussions in the office from concerned parents worrying about the accessibility of vaccinations and whether or not insurance is going to cover them. I can't really predict the future. I'm optimistic and hopeful that those vaccinations will continue to be available to parents who would like to receive them for their children. In terms of insurance coverage, it's up in the air. Some companies have refused to comment as of right now. Others have said that they will follow the guidance of the specialty association relative to those vaccines. So for example, back to school vaccinations would be under the realm of the American Academy of Pediatrics. And they have the vaccination schedule, which is similar to what is currently recommended by the CDC, and they will hold true to that. Insurance companies, some of them have said, we will follow that guidance and we will continue to provide coverage for those vaccinations that the AAP recommends. And I think the reason is because we all know that it is probably far less expensive for the insurance companies to help prevent illness in children than to have an outbreak or treat those types of infectious diseases.
Doctor, let's talk COVID shots now. Where do your recommendations stand? You think kids still need them now?
I think if you ask 100 different pediatricians, you would probably get 100 different answers. Again, the guidance right now says that children over the age of 6 months are eligible to receive the COVID vaccine after a thoughtful discussion with their pediatrician. So it's eligible essentially for all children. I think the children who will benefit the most at the current time are going to be those children who have underlying medical problems that would put them at more risk for a serious illness with COVID, as well as those children who have family members at home that are immunocompromised, and those family members might have a serious illness, because we know that by receiving the COVID vaccination that you are less likely to get infected, but if you do get infected, you're going to shed the virus for fewer days at a time, which means that you're going to protect your family member at home.
Okay, so for kids that have not had their vaccines yet and are going back to school next week, what are the top shots they need to go get before they go back to school?
Yes, so they are going to require their MMR, their chickenpox, their hepatitis B, and their DTaP at the very least to get the process started. And I believe if they have at least started those, then they can attend school, but they will need to continue to receive the booster shots of those until they're fully cleared, because some of those vaccinations require multiple doses, but obviously we can't give multiple doses in the same day.
Yeah.
Doctor, last question for me. obviously shots and maybe going to the doctor's office probably isn't something kids really look forward to. What can parents do to ease those worries from children as they get their shots?
Absolutely. I think this is a teachable moment for parents. Kids are going to go through a lot of different things in their life that are going to feel uncomfortable or scary or downright terrifying. And so it's important for parents, even if parents are feeling a little bit nervous about that appointment, to provide reassurance, to let their kids know that they're safe, to let them know that their parents are going to be with them the entire time. There are so many different age-appropriate books that they can actually read in advance to kind of help demystify some things and make the kids perhaps not feel as scared just walking into it. And then letting them know that sometimes we have to do hard things. Sometimes we have to do things that don't feel good right in that very moment because it's going to be better for us in the long run or protect us in the long run.
I love that shift in perspective. I was always so scared of getting shots as a kid.
Same.
So
Yes.
I mean, I've grown out of it a little bit, but definitely I'm going to start thinking that to myself every time I go get a shot in the future. Well, thank you so much for coming in today. We really appreciate it.
Of course. Thank you for having me.